Well, good afternoon, everybody. Thanks for joining me today. My name is Greg Olsen. I am the director of the New York State Office for Aging, and I'm so pleased to be joined by my friend and colleague, Dr. Ann Sullivan, who is the Commissioner of the Office of Mental Health here in New York State. How are you doing today, Ann?
Good, thank you. It's a pleasure to be here.
It's great to have you back. I often say, and I don't mean to embarrass you, that our Facebook Lives, which have become really popular way to get out not only really important information, but more importantly, connected resources, really started from you. And since we have done this now for over 2 years, we've reached almost 500,000 people. So I just want to thank you again for being proactive and showing us a different way to really reach a lot of people with things that matter to them. As everybody probably knows, May is Mental Health Awareness Month. But this topic really shouldn't be just talked about during one particular month. It is so important to talk about every single month. And like I said, it's great to have you. I think that we got some news that you're going to be able to break in a little bit later. But I wanted to start kind of with an overview. It's not uncommon that for centuries, people that struggled with mental illness, really were stigmatized. Thought is different. We didn't know how to really deal with things going on in the brain, like we have learned with physical health. Certainly during the COVID pandemic, it seemed like, something changed. And if there is a silver lining to something that has really devastated so many families, not only in New York, but across the country and the world, it's what the impact of COVID has meant for children, middle-aged individuals, older adults, and how that's impacted their mental health, and how important it is to take care of yourself both mentally and physically. We saw suicidal ideation go up. We saw an increase in alcohol and drug abuse, COVID-induced trauma, anxiety, depression, economic uncertainty. There was data that came out privately out of social media companies where they knew what the impact on children and adolescents were for their social media platforms and how that impacted their self-esteem. So where we are today, and in what you do every day, your amazing staff, because it's such a pleasure to work with you and all the staff at OMH and your network throughout New York State. Are you seeing a turn of the tides where they're starting to become parity and understanding we need to address both of these things, and it's okay to say, I need some help, and to reach out?
Yeah, no, thank you, Greg, and thanks again so much for having me. But yes, absolutely. I think that, as painful as this pandemic has been, I think it has also shown us that we all have emotional responses to things like this when they affect our world, when they affect everything that's around us. And the media, the other agencies, such as your agency across the state, our governor, everyone has been talking about the impact of this pandemic on mental health. And I just think talking about it, getting it out there has had a massive effect, I think, in terms of people seeking help and being willing to say, maybe this has impacted me. With the pandemic, we had dollars from FEMA that opened up something called the New York Project Hope. And we had an emotional support call line. And we've gotten over 60,000 personal calls to that line throughout the past couple of years. And the vast majority of people who called had never, ever asked for mental health assistance before. So we know that it's having an impact on people, and people are beginning to be willing to call and talk about it. And I think that's probably one of the most important things, because as you said, probably you can go back maybe even centuries to say that mental health was something which was kept under wraps. People felt embarrassed about talking about it. They felt that, I should be able to solve this without asking for help. And I think that was a real detriment to people getting the help they need. But now individuals who begin to feel depressed or have anxiety, or even if you're just beginning to feel like you've lost interest in things, are willing to call and say, can you give me some help? Can I talk about this? What's going on? We had tons of calls from parents who want to know how to talk with their youth when they've seen some changes in the way they're behaving. How do we talk about that? How do we bring it up? And, you know, the important thing is to talk about it and to address it. So yes, I think that's one of the quotes, if you want to say a silver lining to the pandemic, is that mental health is front and center. The other flip side of that is that we have to be able to deal with that tremendous need right now. And I think, as you mentioned, one of the most critical needs has been among our youth, where we have seen a large number of individuals, probably double to triple the number of youth coming to emergency rooms with serious anxiety and depression. So we're talking about, you know, youth aged usually about 10, 12, 13 up through late adolescence. And that's something we hadn't been seeing in those numbers before. So we have to be ready to deal with that and be able to help parents and communities deal with it. So, but the important thing is people are seeking help.
Yeah, I think that is the important thing, and I hope that that trend continues. I think that, you know, we think about a lot of different things, from people that provide care to, you know, a child or an older adult or a sibling, et cetera. You know, often people feel like I'm alone, I'm the only one dealing with this, and I think your numbers show that is not the case. People are not alone, and it is okay to ask for help. You know, you mentioned, you know, our governor, who has just been so spectacular on so many different issues, you know, for my agency, for your agency, other agencies. But there was a major announcement yesterday that the governor announced that you were a part of, establishing a statewide 988 system. Can you talk a little bit about what that is and why this is really so historic?
This is so exciting, I think. You know, it's basically the simple number 988 can get you directly to an emotional support line, can get you directly to a crisis line. Just dial 988. Basically, this is national now. It's much like, it's not 911, but much like 911. 3 digits, you can call and you can get assistance. And the individual answers that phone can do a couple of things. The person who answers the phone can talk to you if you're calling in a crisis and you want to talk about something that's happening with you or a family member. They can provide that support right on the line. They can also refer you to further support or further services if that's what you need. And basically, these calls will be answered in New York State. It's anonymous. You can give your information if you want to, but it can be totally anonymous. And you can just dial 988. And that crisis support line will be there and will be available. We used to have a line, which was a suicide prevention line, and that had a very long, complicated number. But that's now been subsumed under 988, so that 988 is available. And it's there if you're feeling very, very acutely distressed, but also if it's not so severe and you really need a little help just to kind of face some of the problems you're dealing with, or maybe some advice about your kids, you can call all the way along the continuum to 988. So we're really pleased this is coming out. It's going to be announced. We have call centers all across New York State that are ready to take the calls and have been trained with counselors who can be on the phone and can respond, so that we're pretty sure we're able to take the full volume of people who will be calling, and that phone will be picked up quickly. So we're really very excited about this coming out. And I really do think it's a game changer, because it's an easy access way for people who are having some kind of emotional distress to get the help they need.
Yeah, I agree. I think it's exciting. You know, the other thing is point of contact. It's often very difficult when you don't have something simple and easy to use with actually trained human beings to go through your phone book, or to, you know, look up on the web if you have access to the internet, something close to me. So the fact that you only got to dial 988, these are New York trained individuals, and that it's not a referral service. It can provide a referral, but these are individuals you can talk to that will pick up the phone immediately. I couldn't agree with you more. I think it's spectacular, easy access, somebody right there, and then a referral if needed, but you have somebody who's trained, who's on the other end. And that really is a game changer. So congratulations to, you know, you and your team and the governor's office and all of those that were in the press release yesterday. I just want to make sure that I'm clear that the phone calls won't start being taken until Saturday morning. Am I right on
It's Saturday. That? It's Saturday. Yeah, it's Saturday. I should know the date, but I think it's the 6th, 15th, 16th.
Yep,
what
so
is Saturday? It's this Saturday.
Now you can access this on Saturday. If you're watching this past Saturday, July, what would that be? Like the 17th, and it's live now.
Yes. And then it will be live. So we're just getting the word out a little bit, a couple of days in advance, a little bit in the governor's announcement. But this Saturday, it begins. So you can just dial 988 and you will get someone on the phone.
So we're gonna shift gears and start talking a little bit about different populations. Now, what you do is, and your networks do, are address behavioral health from birth to death, and that's really important. What our organizations does is serves older adults, but older adults live in families. They have children, they have grandchildren. We have 350,000 grandparents taking care of grandkids. There are thousands of grandkids taking care of grandparents and everything in between. I often say, you know, an older adult just doesn't live in the state office for aging. They touch every single system out there, from tax and finance to housing to OMH to OASIS, and I could go on and on and on. But let's start with the older adult. What resources and services are available to older adults who feel overwhelmed in New York?
Well, I think one of the things that, first of all, 988 is certainly available to older adults. So please use that number. The other number that we have, and we've been running for like 2 years now since the pandemic, is the New York Project Hope emotional support line, and that's in the chat. And basically that is another counseling availability. Again, you can call any during the week, 9 to, I think it's 8 a.m. to 8 p.m. all week long, and you will get a counselor on the line. And that support line has been very effective in terms of helping individuals with all kinds of questions and stresses, et cetera, during the pandemic. Nothing too big to call about and nothing too small to call about. And that's both for 988 and for the emotional support line. The other thing that we have is a crisis text line. And I think that, you know, we underestimate sometimes even older adults know how to text, you know how to text, texting a lot. So the crisis text line is got 5-741-741. And that's 24/7 and totally anonymous. And people, we have found a lot of use of the crisis text line, because I think sometimes it's easier for people to just text anonymously something that's bothering them versus even picking up the phone to call. So we want to have all kinds of access points, whether it's the phone to call or the crisis text line. The other thing I think is some people don't like to use those things. They want to talk to somebody they know. And so I would always encourage people to talk with their doctor, you know, their primary care doctor or one of their caretaker. They understand these things and they are well connected. They understand how to refer and also how to help. And often we're reluctant. People don't think that your internist or your primary care doctor is going to be interested in these things, but they are. So I would also encourage, if you want that personal talk to somebody you know, that's often a way in to talk with your healthcare provider and let them know. If you need assistance, if you need services, et cetera. And then there's all on our website at OMH, we have all the listings of all the services that are out there, including a whole network of clinics and support and treatment services that are out there that can be easily accessed, you know, by both phone or. So we have a whole treatment system network, but if you're not kind of too into getting into all those little pieces, then those simple numbers to call, 988 or the New York Project Hope helpline are the easiest things to call.
Now, and I appreciate those resources. You know, the whole purpose of this, not only to get information out, but the information is useless without connecting to resources. So I'm going to thank Roger in advance for putting those resources in the text, the chat, so that folks can access them. So those are, you know, some recommendations really for anybody on the individual side. We have what we call, and I hate this term, it's an industry term, we have caregivers in New York State. We often call them informal, but here's who they are. We have over 4 million people who are spouses, sons, daughters, aunts, uncles, grandkids, friends, neighbors, who provide uncompensated care to individuals every single day in their homes and communities to help them if they need help with a whole variety of different tasks. We saw a lot of real serious data from CDC during the pandemic, especially for those caregivers who are working, that showed, like I said earlier, increase in drug and alcohol abuse, using food to cope, 70% had COVID-induced trauma, you know, usually anxiety, depression, a real increase in suicidal ideation. So on the self-care side, these are people who are caring for other people, right? They have to take care of themselves first. So how can people who are caring for or even worrying about an older adult or any other loved one that they might be assisting, practice their own self-care.
Yeah, no, I think your own self-care, I think for all of us is important, but you're absolutely right. I think for caregivers, it's especially, the data was really very remarkable. I think the most distressed group of individuals who had actually thoughts about self-harm were the caregivers when the CDC did those studies during the midst of the pandemic. And I think, there's big things you can do, but there's a lot of little things you can do for self-care too. And, people think, well, that's not going to help, but I can encourage you to say that it would help. So even simple things like sitting down during the day, doing some deep breathing exercises for 5 minutes, just 5 minutes, where you just sit, kind of clear your mind of all the stresses, breathe in, breathe out. We have instructions for this on the New York Project Helpline. There's also on the OMH website. So you can, just those simple self-care practices are very, very helpful. Little exercises that you do, if you're taking care of someone all day and you're helping them, what can you do that can relax you? Things like, certain arm exercises, just sitting at a desk, just looking at a video, that kind of thing. And then those are the simple things you can do by yourself, for yourself. But then there's also reaching out to friends, family, talk to people about what you're doing. Don't feel, caregivers by their nature don't ask for help very much. They don't ask for support. And there's, I think, often support all around us and we don't ask for it. So then you can ask for it through our helplines, et cetera. But you can also ask for, get it from friends, from family, et cetera. And I think that you have to feel like caregivers feel like they should be able to handle everything, but nobody can handle everything. We all need to be able to get support, whether it's people we know, or whether it's professionals that we reach out to, or counselors, or just doing our own self-care. The other one is mindfulness, which a lot of people do nowadays. There's all kinds of websites about it and how to do it, but it's a way of kind of getting in the moment and letting the stress of the rest of the world melt away a little bit. Those kinds of self-help things are very, very important. And then if it gets really too stressful and you're feeling like, geez, I'm just down all the time, or I don't like doing this anymore, I don't know what I'm going to do, I'm feeling really, then you should not hesitate to reach out and get help. I mean, you should really call for help or talk to your family doctor or call for help on one of our lines or go to one of our services. It's very hard. Caregivers never want to admit that they need care themselves. But when it gets to a point where you feel that you're not just yourself anymore and it's not working, go get help. Don't hesitate. Don't hesitate.
Yep, that's great advice. And I'm going to ask Roger to put 2 additional resources in. So we're talking about, people who are caring for others, and you can't care well for somebody else if you're not practicing the self-care that Ann just talked about. We launched about a month ago, and it's free for any person in New York State who is caring for somebody else. It doesn't matter what age. A partnership with an evidence-based platform called Trualta. And it provides education, information, strategies, and connection to community resources all over New York State in bite-sized pieces, audio, video, or text. And what we've learned from, surveying businesses, public and private, is that's the way that people who are working want their information. So I'm going to ask Roger to put that in there. You can use that for free. And our Caregiver Intensity Index, which we partnered with Archangels out of Boston, Massachusetts, which takes less than 2 minutes so you can identify, are you in the green, the yellow, or the red? And if you're in the red, some strategies to get you out of the red and connecting to resources. So thanks for that, Roger. Thanks for those suggestions.
And I have to second Trualta, because I've been to their website. I took a look at what they're doing, and I'm telling you guys, if you're out there, go. It's great to see. It's got tremendous assistance. It's very easy to use, and it's got a lot of very helpful hints, the kind of stuff I've been talking about, but also a lot more. So I think, use it because it's a very user-friendly online internet kind of.
Well, I very much appreciate that endorsement. I didn't expect it, but you're absolutely right. And like I said, it's free. We're fully subsidizing it for anybody in New York State.
It's cool.
Let's shift gears to kids. You know, I have daughters. Many people have children, and you spoke very eloquently about what the impact of the pandemic has been. I felt that in my own family as well. It's been very difficult with schools closing, social networks like you know, softball and volleyball and things where people can gather, or even play dates that just cease to exist. And then you add, you know, the time on your hands, the social media, the self-reflection that you don't look like what you're seeing. What types of support or tips would you offer parents of young children or adolescents? Because I'm not sure that this problem, hopefully the pandemic will go away, but I'm not sure that the problem is going to go away. And so for parents like me and others, where can they go to get support, and maybe some tips for them as well?
Yeah, I think, you know, youth, you know, as we know, kids are also very resilient. So they can have some days, good days and bad days. But when you begin to see a change in your youth, younger or even adolescents, it's kind of lasting, it's concerning. Then you should think about getting some help or talking with them first. You know, with little ones, you know, I'm talking about kids under, you know, up to age 3, 4, 5. Often what you will see is if they're getting upset, it's a kind of, they get more irritable, a little fussy. They don't sleep so well. Sometimes they don't eat so well. Sometimes they will regress a little bit into behaviors that were younger. And we saw some of that during the pandemic, where kids who were potty trained kind of lost that for a while, or other kids that were doing really well in school and being social, when now that school wasn't there and they weren't involved as much, got a little more withdrawn. So you will see that. And if those changes last, then it's worth thinking about, should I with little ones, you can still talk with them. You know, you can still ask if they're verbal. You can say, you know, how you feeling. Don't ever be afraid. You know, I often hear from parents, well, if I bring it up, if I mention to my youth that are you feeling down or depressed, or for older adolescents, if I ask, have you ever thought about hurting yourself? That'll put the idea in their head. No, that's not the case. It's not the case at all. Really, when you bring it up, it opens up the opportunity for that. You say, believe me, if they're not thinking about it, they'll just tell you that. And if they were, it gives them the opportunity to talk to you about what's bothering them. So don't hesitate. Often with the younger kids, I think often the first stop can be going to your pediatrician and saying, because they can give you some, you know, really advice. They know you and they know your child. And then I think for older kids, you might, you know, again, you look for changes where they begin to withdraw, aren't so interested in things anymore, maybe are more irritable. You've got to think about possibility of using substances. You know, we've got to worry about that, because kids can get access, especially in those teenage years, to things that they shouldn't be taking. So you have to think about that. And then also they can give her, you know, the kids are moody by nature, but if the moods last in those adolescent years, then I think you've got to think, you know, is your youth depressed or overly concerned, overly worried, or too withdrawn? And the big thing is a change, something different. Your child, the youth, not the way that they were, something's not back to baseline. So you really want to talk with them about it then. And I would first talk with them and see, open that dialogue. And often that's enough. And then if that isn't, then again, the opportunities are to access all the 988, all the numbers we put in, talk to your health care provider, who can often give you a connection to a mental health provider. And then there's also all our, you know, our whole healthcare system, that mental health system is available. But don't hesitate to seek help if you really feel your child is suffering and somehow you're not understanding enough, or they're not getting better enough, then ask for help and go reach out.
Yeah, and I think that you guys could not have made it any easier with the Project Helpline, with 988, with the text service. You know, we'll put the website on for all the local contacts. Of course, in our New York Connects database, you know, you and Department of Health and OASIS and OPWDD do a quarterly data dump. So there are a lot of ways to access. But I think what you said really resonated me when, you know, my kids were very little. The pediatrician always said, you know, if you see a change, something is probably wrong, bring them in. And 99% of the time, he was right. It was a fever. It was an ear infection. But that to me is very much in line with what you're saying. There's easy resources now to make that first step, and either, have a referral made or understand that what somebody's dealing with might be normal versus not normal, but then making those local connections. So, I think it's about as easy. You guys are making it as easy as possible, and that's the first step. Beyond the COVID pandemic, and I'm hoping that, we're going to at some point get out of this. I just don't know. What are the other challenges that you face in the mental health profession to really meet the needs of all New Yorkers, depending on what they have?
Yeah, although it's gotten much better, I do think that the stigma associated with mental illness is still there. So I think we all need to work together. Agencies across the state and all the healthcare providers, et cetera. There are subtle ways. For example, insurance companies sometimes still don't cover what we call parity for services for mental health and substance use, the way they cover services for physical health. So there's all kinds of things that are still subtle in the way that stigma and some discrimination against mental health and substance use issues. So I think that's something that we're still gonna have to fight. And I think it's gotten better, but it's something that we're gonna have to continue to fight and make sure that, there's a saying from Surgeon General Satcher, when he was the Surgeon General, who said there is no health without mental health. And I think one of the things that we're still trying to deal with is making sure that there's an equal kind of representation of mental health. Mind and body go together, mental health, physical health, and that you can't separate the two. So those challenges continue. I think we've gone a long way in terms of working with medical providers. So primary care providers now screen for depression, they screen for substance use, anxiety disorders. They know a lot more, they're there. And I think that's been helping in terms of stigma. And then the other big thing I think is pushing for increasing mental health education in schools. This year, actually the schools are very, very active with us in terms of trauma-informed learning and dealing with the post-pandemic. And I think embedding an awareness of what mental health issues are in schools is so critical, because if kids can grow up feeling that way, that there's no difference between if I'm having a problem feeling, is the same thing as if I hurt my arm, and that I shouldn't feel bad about saying to somebody, I'm feeling down, low, that can make a huge difference for generations to come. So we're working a lot with schools, and I think that the schools are really open. And I think one of the things that the pandemic has also made more open is the need, really, and the schools are well aware of that, of bringing mental health services into the schools. So we have a lot more clinics, but we're also doing a lot of education. We're doing a lot of work with the schools to help them deal with what they know in September, is going to still be very difficult. Even though schools have opened up a bit, it still hasn't kind of gelled back to even what it was pre-pandemic, but we want to do even better than that in terms of mental health educations and supports in schools. So those kinds of things, I think, are still works in progress that we're going to continue to do, have services available for all New Yorkers, and then especially for those who have significant serious mental illness, to make sure that they get the whole array of services that they need as well.
I think that's amazing. And you're right. There's so many things that, should be brought into the schools. This is clearly one of them. So it's a huge success. And, again, what you learn at home versus what you get exposed to every day through K through 12 or whatever the education is can help counter sometimes the negative things you learn at home. So I love to hear that. We're about two months or so removed from the budget. And, I've been around a long time. This is the best budget I've ever seen, certainly for New York State Office for the Aging. And I understand it is for the Office of Mental Health as well. What are the types of investments that are really going to help beef up your ability to do what you're doing and many of the things that you've been talking about today?
I think I agree. This is the best budget I've ever seen. And I think that Governor Hochul and her team have really invested in mental health in a way that we just never had before. So it's really terrific. And just as you said at the beginning, it spans the whole lifespan and the whole span of mental health issues. So we've got we got dollars for prevention. One of the things which we're beginning and will hopefully grow is having a mental health practitioner, clinician working side by side. I've talked a lot about pediatricians and primary care doctors working in a pediatrician's office and there from the very beginning to be counseling, et cetera, not worrying about whether or not you have mental illness, but just working for the stresses and the things that people have that they bring in. And we got dollars to expand that. It's not everywhere, but to expand it in Medicaid and hopefully to continue to expand it. So all the way from that early prevention through lots of dollars for schools, for mental health in schools, to then individuals who have a mental illness. So individuals who are depressed or individuals living with bipolar disorder or schizophrenia. We have an increased dollars to support the supported housing for those individuals, tremendous increase in the budget in supported housing dollars. Our providers who provide all these mental health services, and the budget got a COLA increase, what we call a cost of living increase, which we hadn't had for years. Special teams to work with the homeless. Those of us who live particularly in some of the urban areas across the state know that there are individuals with mental illness living on the streets, and a lot of dollars to work with them going forward. We also have we have the continuation of our grants for the geriatric population in terms of the $9 million going forward. So really the whole lifespan, including all the issues, all the way from prevention to treatment to long-term care for individuals as well, is just incredible. So it's a really exciting budget. And of course, 988. And along with 988, the growth of, we're not there yet, but the growth of a very comprehensive crisis system, which will include mobile outreach, crisis centers, and crisis residences. And we're building those across the state. It's not as robust as we want yet, but we're building that across the state, and a lot of dollars to grow that crisis system across the state. So, and lots of money for, for youth mental health. Youth mental health first aid is something that we have recently gotten a couple $1 million for. We'll be sending it out across the state, which is for those individuals who work with youth, specialized mental health first aid. And I think that's going to be great. We're going to be spreading that across the state. So a wonderful budget. I think I agree with you. I've never seen this kind of investment. And I think it really invests in both the structure that we needed, like making sure that our providers are paid well, all the way to innovative new prevention and work with special populations. So very exciting.
That is exciting. And I think I'm going to speculate here, but I know this is factual. Good leadership always brings good results, and poor leadership brings poor results. And this is really a testament, Dr. Sullivan, to your leadership, that of your team, this incredible governor that we have that really recognizes how all of us kind of fit together. While we have specialties, we need to connect the dots, and we do that. And that there were things that were seen and really highlighted during the pandemic that we just had to respond to. And so the budget in, my budget and your budget and other agencies, workforce investments, et cetera, really recognize the areas where we need assistance, and we put our money where our mouth is to help the people that we're charged to help with. So, I just think it's great leadership on your behalf and that of the governor. So congratulations to that. I'm going to ask Roger, I believe we have a couple of questions to unmic and see what we have.
Yep, we have a few questions in the chat. First one, I love info for teens who have an older parent who is dealing with a degenerative disease.
What kind of info are they looking for? Are they looking for service support that we could help them with, or is it more connection to a mental health professional?
If someone chimes in with a little bit more info, I'll share that, but maybe we could address both of those.
Yeah, but I would suggest that at this point, that person as of Saturday, call that easy 988 number to talk about what might be available. We also have, and we could send this out, depending on where the person lives, we have what we call field offices for the Office of Mental Health. And if you can go to the OMH website, those numbers are easily available. They're called our field offices. And that might actually be a good place to call. Call the field office number and say that you're looking for help, because you're talking about a very specific kind of thing, help dealing, it's either your personal dealing with a parent who has a degenerative disease, or services, et cetera. They could also be helpful. So either the New York State Office Mental Health website, look at the field office in your area. We have 5 field offices in the state, and call them directly. Or if that's too much, then just call 988 and ask, or the Project Hope emotional support line, which is up now, and they will connect you to someone who can help you with that issue.
We got a little bit more specificity, if you don't mind me just chiming in here real quick. Looking for a connection to other teens dealing with the same issue. So that's another sort of dynamic there.
Okay, but that's, you know, I'm not sure if I'm going to have to look at that one and see if we have lots of, let me say, we have lots of peer support groups, and we have some groups for teens, but I'm not, for that specific issue, I'm actually not sure if I could give you the name of a group for that right now on the mental health side. So let me, what I would do is call that field office that I talked to you about, or you could even, let me give you my email me, ann.sullivan@omh.ny.gov. If you feel comfortable doing that, just email me and I'll find out. I don't know off the top of my head what we have there for other teens dealing with that specific issue, but we do have some groups for teens dealing with a host of issues, and that might be okay to relate to them, even if it's not that specific group. So, you know.
Yeah. And from our side, if you're willing to reach out to us as well, we have a very robust statewide caregiver support system. We may have support groups that include younger individuals. Of course, we have the True-Alta app, which you can use right away. But depending on the county that you're from, we'd be happy to make a couple of calls to our local offices for the aging to see if there are peer support for younger individuals that are taking care of an older adult.
Yeah. Thank you so much for that question. That's really important and really sets off with something we need to be thinking about too. Thank you.
We also had another question relating to resources in other states, and you know, some people, you know, have an older adult that they care for, you know, sort of remotely, or they're worried about in another location. So are some of these resources that we're talking about in New York State, are there similar ones in other states, or maybe there's some advice on how to help coordinate for someone who's living in another state, how to help them?
Well, I think that what Dr. Sullivan mentioned earlier is 988 now is a nationwide number. So that should be available. I am not quite sure if there's a rollout time frame and elsewhere, but every state has a state unit on aging, like the New York State Office for Aging, and have local county offices for the aging that you can contact for aging service programs, connection to other systems like the partnerships we have here in New York State. But I'm assuming, Anne, are different, are different points in terms of the national rollout?
Yeah, I think what you can do, if you call 988 and the question is about another state, they will be able to connect you to that other state to talk about the issue in that state, or get you connected to them. In all the states, there's an office like our Office of Mental Health here in New York, and they have various services, and every state right now has some degree of a crisis intervention kind of service going on as well. It can vary from state to state. So there are the state offices, but also I think you can call that number, and that number should be able to connect you to someone in one of those states to be able to talk with about it. If they can't, they will at least get back to you and get you the number of somebody to talk to.
Yeah, and if you'd like to reach out to us as well, depending on what you're looking for, I know most of my counterparts across the country. I'd be happy to try to facilitate a connection, depending on the state.
Yeah, and the other advice I'd given before too, you go to our website and you go to our, or you can also, email me, but also go to the website, and the aunts, our field offices where you live, they will help connect you to what's in the other states as well.
Perfect.
So, they will also give you a connection of who to call.
Roger, any other questions?
That's all we have for now.
Okay, so we talked a lot. There's a lot going on through the Office of Mental Health and many of their state level partners, but also their community level partners. We provided you with a variety of tips and suggestions, but more importantly, the really centralized, easy access resources that you can get connected to. Don't be afraid to pick up the phone. You don't need to suffer, in silence. You are not alone. There are a lot of people that are dealing with a lot of these issues because we're in a really just a different time with so many stressors coming from so many different areas. And we see that. We see that through the data. We see that through the increase in call volume at OMH. And, you know, these investments are really designed to assist you and your family members in getting the help that you need, regardless of what age you are. So, you know, Ann, I'm so thrilled. You know, we love working with you and your office. Your leadership and your passion is crystal clear. There's a reason that, you know, the budget is great. Again, that's because of your leadership and that of our governor. And I can't thank you and your team enough for all that you do, for all New Yorkers, for the work that you do with us, and for, you know, spending time with us today. This is really an important topic, and I'm sure we'll have you back again. So thank you so much for your time and all that you do.
And thank you, Greg. And the feeling is entirely mutual. I think all the great work you do and the great work of your agency, and it's just such a pleasure working together. And your creativity in terms of all the services that you've made available for older New Yorkers across New York is just remarkable. So I thank you on behalf of also being an older New Yorker, to thank you for all the work that you've done and everything that you've offered in terms of your agency. Really, it's truly remarkable. So thank you so much.
Thanks. We're going to wrap up today. We're going to take a couple of weeks off for the summer. We got a packed agenda coming in September and then the months that follow. So we'll get that schedule out to you in the next month or so. But you guys have a great summer. Stay safe. This pandemic is not over. The BA.5 variant seems to be rampant. Take the precautions that you know you need to take to keep yourself safe. You know, people are counting on you, and you're counting on others. Let's all stay safe together. Have a great summer, and we'll see you in September.
Great. Thank you. Have a great summer, everyone. Take care. Bye-bye.